Night routine with a feeding tube. Starting off with washing my hands. I know that this isn't a sterile procedure, but I do want to decrease my risk of infection, especially because I have a dog and I pet her multiple times a day. I'm going to start by preparing my syringes. This is for my flush. Next, I'm gathering together my supplies. I'm going to be using 2 alcohol swabs and some skin prep, and then prepare my Hypafix tape, which I set aside for later. Next, I'm just going in with my tube care routine. I do this twice a day, once in the morning and once at night. This is to make sure that my stoma site stays clean. It decreases the risk of infection, and it can also help with granulation tissue. So if you don't know what granulation tissue is, that's basically an overgrowth of tissue that can be really painful on the stoma site. And if I have that, I usually do a mix of Desitin and salt, but today I just did Desitin because my site looks really good. I do this twice a day to also decrease any drainage around my site. It was also bag change day. My bags are meant to be used for 3 to 5 days before I switch them out, so that means I wash them in between uses. And here I'm just taking out my old bags, I'm giving my plants whatever water is left over and switching out my bag. The pump that I have is an Omni that has a 2-bag set, so that means that 1 bag is for feed and the other bag is for flush. The type of formula that I use is the Complete 1.5, so that means that I get extra calories per carton. That makes about 1,000 mLs throughout the course of a day, and I'm usually on feeds for about 18 hours every day based on my rate. Once my pump is primed, I go about my regular routine, such as brushing my teeth on the floor because I'm exhausted, and then I get into flushing my tube. This is a really slow process because it feeds into my intestine, and so you can't just shoot a whole bunch of water into your intestine. You have to do it quite slowly. Once I'm done flushing, I tape it back to my side. I like to go in with some skin prep because I'm allergic to adhesives, and this decreases my chances of getting a reaction. Then I tape it back to my side. I connect myself and use my port covers and clips to keep it from leaking on me in the middle of the night. And then I hit start, take my night meds, and that is all. Thanks for watching. Bye.